Hey, good morning, everyone. The Markkula Center for Applied Ethics is excited to have everyone tuning in today to join us for this Get Vaccinated webinar. During the next half hour, we will be discussing how the pandemic has impacted children in various ways, as well as what is on the horizon for vaccinations in kids. This will be the last installment of our COVID vaccinations and back to school series of webinars that we have focused on how the COVID-19 pandemic has impacted children. To introduce myself, my name is Amana Liddell, and I will be hosting today's webinar. I am a senior at Santa Clara University, and I'm a biology and psychology major. For the last couple of months, I've been working with the Ethics Center to help with this Get Vaccinated webinar series. Our guest today for the pandemic's impact in vaccinations in kids is Dr. Dao. For his undergraduate degree, Dr. Dao attended San Jose State University before going to St. Louis University for his medical school. He then completed his medical training and is now the Chief of Pediatric Primary Care at Kaiser Permanente Santa Clara. Dr. Dao, thank you so much for joining us today. We are very excited to have you give our audience a chance to hear from you.
Yeah, thank you, Amanda. It's a privilege to be invited by the Ethic Department and yourself to be here to answer questions or clarify some concerns or give you guys update informations about COVID vaccinations, both in adults and kids.
Thank you. So to start us off, we're just going to talk about a little bit about how COVID has impacted the pediatric population. Could you tell us a little bit about how you have seen COVID-19 affect your patients and other children?
Yeah, let's take us back from the beginning of the COVID situation. That was back in March of 2019, if you guys recall. That's the first time we kind of see Santa Clara County having cases of COVID, come into the county. And basically, we at that time nobody really knows how impact it will cause to our pediatric populations. However, as we progress and there's more cases, we found that the infection in the kids are low, and if our kids get infected, it turns out that their symptom is really, really mild, and the hospitalization rate is rare. It's so low that we and we can treat everybody and nobody gets hurt. Now, as the and then when we shut down the schools, there's less interaction, so that helps. And when people wear masks, that helps decrease the transmissions. And then we thought we got it kind of beaten when the vaccine come about last December. However, as you know, viruses the virus does change and mutate, and then we see different strands. So there's a Greek alphabet names for all of these variants. And the most recent variant, as you all know, is the Delta variant. And now, and then kids are back to school, and then some cannot wear masks, some are opposed to wearing masks. So the infection rate has gone up. When we see an infection rate gone up, of course we're going to see a more variety of severity in the disease, and therefore we do see things like vasculitis as a complications, myocarditis as a complications, and hospitalizations, and death, because this is a respiratory virus that can affect your respiratory system and enable you to get the oxygen, and therefore no matter what you do as supportive care, people die because of that.
Yes, and I think you definitely hit on the point of at the very beginning of the pandemic, kids kind of stayed in a little bit of a safe bubble, keeping away from COVID. And it wasn't until recently that we really saw COVID and how it is really harmful towards children as well as adults. Another question that I have for you is, what are the symptoms that we should be looking out for of COVID in children? Because you mentioned that they kind of show up a little bit differently.
Yeah. So actually, when we see kids from birth until 18 years of age, and that's the age range for pediatrics. Now, kids who can tell us, they can tell us that, hey, I'm losing my taste, I'm losing my smell. But the symptoms is a long list of symptoms. So fever, sore throat, headaches, vomiting, nausea, fatigue, muscle aches, rash, and then lose of smell, lose of taste. Those are the most common. And now, as you know, the colds coming in. Anybody who call us, I mean, the school will send the kids who have runny nose, stuffy nose, cough, or fever, or headache, or sore throat home. And the first thing we do is that either the school provide the test, or we can do the test, and then we can let the kid go back to school once we found out that the COVID test is negative. If it's positive, then we counsel people how to isolate and how long to isolate for.
Okay. What should parents and educators know about keeping their kids safe from COVID-19 as kids are returning to school and we're getting into cold and flu season?
Yeah, that great question. I think the best thing to keep your kids safe is to talk about COVID first and let them understand that this is not a nice virus. You can put it in their terms that it can hurt you, and therefore here are some steps that you should take to protect yourself from this virus, because if you get this virus, you're not going to feel well, and sometimes you have to end up in the hospital. And just be really honest and talk to the kids that way, and then list out the steps. So the first step is good hygiene, meaning that when you go to school, don't share your food, don't share drinks. Send them with a small bottle of gel, like I always carry on my backpack like this, and hook it to their backpack. So anytime that they touch something or before they eat something, they should just gel, and then keep their mask on, and then show them how to take it off properly, how to put it on properly without touching their face with their hands. And then also stay distancing at least 6 feet when they're talking to their friends and when they play. And if you take all of those steps and you add it together, it's so effective to prevent the spread of the virus, and it also effective against catching the virus.
Yes, and I think that's a very important point. There's not one thing that people can be doing to keep themselves safe from COVID, but really it's the culmination of multiple different practices and different ways that we can protect ourselves from COVID-19 that really helps us not get infected.
And so now get vaccinated.
Yes.
With available.
Yes, exactly. And so that kind of brings me right into our next section to talk about vaccines, both in children and teens and adults. And so I know one really burning question that people have right now is, how close are we to vaccinations for kids under the age of 12?
Yeah. Thank you for the question. So I'm going to take us back a little bit too. At Kaiser, we do the research vaccine for the kids way before it was approved for adults and kids over 12. And my department members have their kids volunteer to be in the vaccine studies. And we have a long list of volunteers that we have to turn people away. Now, we're just one of 100 or 200 medical centers that participate in the study. What Pfizer and its partner did was to have multiple centers doing the study around the countries, and each of the center, let's say they set it a group of 100 candidates for the study, and it's a double-blind study. So you get either control or the real vaccine. And then after, after the study's over, they're going to unblind. And if you got the control, then they will offer you to get the real vaccine. So when we look at those studies and I talk to my research nurses here, we have two research nurses here, and I have to sign off for them to do the research in the department. And I look at the data, and it was so safe because I keep asking them, what kind of side effects do you see? What kind of things, can this be bad for the kids? And they just say, no, Dr. Dao, all we see is just pain, sometimes local swelling, redness, but nothing other than that compared to other vaccines that they're getting. I mean, we give vaccines to the 2-month-old, 4-month-old, 6-month-old. At that visit, I give 3 vaccines, and it has 5 components in 3. And then at the 1-year-old, I give 6 vaccines. I mean, up to 5 or 6 vaccines. And this vaccine is, so I can see what kind of side effects compared to the other vaccines. And we thought it was really safe. And we know for sure that this will get approved from the get-go. But we also want to make sure that we collect all the data and analyze it and send it to the the Pfizer company to analyze it. And so then it's safe. And then it starts to roll out to 12 and over, and now they're talking about 5 and older. And basically, the plan is to the FDA and the CDC. Well, first the FDA is going to approve it, and then the CDC is going to announce it. And it's probably going to be at the end of this month, probably sooner. They say the end of the month, but it's probably going to be early next week. And then what Kaiser has been doing is that we have been meeting to prepare for the influx of people who wants the vaccine to be getting at Kaiser. But I can tell you that pharmacies around the area, such as Rite Aid, CVS, Walgreens, and then also solo pharmacy, that standalone pharmacy, will have the vaccines for us. And I recently, 2 weeks ago, I got my 3rd Pfizer vaccine at a Rite Aid, and it's very convenient, very fast, because I know that sometimes I want to leave my spot here at Kaiser for somebody else who can come and get it. I also volunteered to give the vaccine at Kaiser, the COVID vaccine. So I did it 2 weeks ago, and I gave it to kids and adults. And people haven't reported much. I know that one of the complications that was reported with few cases was the myocarditis concern in adolescent who gets the vaccine. It tends to kind of appear, the side effects tend to appear about 4 days post-vaccination. So we are well aware of that. Anytime our patient call us saying that, oh, my chest is hurting, we will ask them, when was the last time you get the COVID vaccine? If it's within that 4 days, we will bring them in. We'll do an EKG. We draw a heart enzyme called troponin to rule out any inflammation of the heart right away. And I had 2 patients who were concerned, but it was after their first dose. Usually it occurred after the 2nd dose, by the way. But I went ahead and do it for them anyway, because I just feel that it will put their mind at ease, not have to worry about, am I going to have a heart condition with this? But besides that, I don't see any side effects.
Okay, thank you. And so that brings us kind of into the adolescence conversation a little bit. And I've heard mixed things. Do teens experience similar side effects as adults to the vaccine, or is it much more similar to the 5 to 12 age range, where it's more of just the tenderness of the arm?
I think everybody's going to be different, Amana. And since we haven't done the kids 5 to 12, we really don't know. But from the data that we get, at least for that small group of patients, we don't see much of a side effect. Now, the side effect, the soreness, the redness, is shared all the way up until, when you're an adult. I have adult friends that after the second dose, they had to take a day off from work. And it's like, it depends on where you're at with your own immune response as well, and how you take care of yourself. That's why we always stress nutrition. You got to eat 5 times a day, you guys. Breakfast, snack, lunch, snack, dinner, and eat 50% of what you eat should be vegetables, so you get the vitamins and mineral, 25% carbohydrate and 25% protein. And then take your calcium and take your vitamin D. Exercise every day for at least 1 hour, and then sleep at least 8 to 10 hours, even for you at college. Because if you do all those 3 things well, your body's going to be strong. It can take almost anything that comes at it. So we tell people that, as far as side effect, nothing to be afraid of. Yeah.
And I think that brings up a couple really good points. One being, while there's things like social distancing and maxing and getting vaccinated that are super important for us to do, there's also lifestyle things like nutrition and exercise that can also contribute to our immunity, and different things like that just keep us healthy when it comes to COVID-19 and just illness in general. And then it also kind of brings up the point of, from the perspective of adult vaccinations, I know a lot of people are concerned about after that second dose kind of being out for the day, or something like that, just from the side effects. But at the end of the day, I think myself and many others, I would much rather be out for a day from getting the vaccine than out for a couple of weeks, because I got COVID because I didn't get vaccinated. And I think that's one perspective that people don't always consider when they're kind of deciding if that's something that's preventing them from wanting to get the COVID-19 vaccine.
Yeah, absolutely. Not only that, you're risking your life if you're gonna, who knows, if you're one of those person who have a severe disease that end up in the hospital, if you're not vaccinated. Vaccination have shown that to prevent hospitalizations, right? And then the booster that just announced, I got my 3rd dose of booster because I'm a healthcare provider. And today, an article in Barron says that when you get that 3rd booster, you're back up to 96% protective. That's amazing for vaccines. Getting the flu vaccine every year, you guys, only give you about 30 to 50% protection. However, we still should get it, because just imagine if you don't, and if you get it and you have at least partial immunity, you at least can fight this virus, versus when you don't have anything.
And I think that's a very good point. One question that came in from our audience is, we've talked about that vaccines for children 5 to 12 will be approved soon. But what about that 0 to 5 age range? Where are we at with that? And what steps need to be taken in order for the COVID-19 vaccine to get approved for that age range, or if it will be approved for that age range?
Yeah, so it's going to require additional study and clinical trials. So after this 5 and over is roll out, they're going to go ahead and start the clinical trials for 2 and over, and then get the data first. And from the data, then we can say whether it's safe for those kids and what is the dosage. As you know, the 5 to 12 is getting only a third of the dose of the adults, and that's what they determine that is the right dosage, because they have to give a little less. Some vaccine, like the flu vaccine, you give the same dose to the 6-month-old versus an adult. So it all depends on clinical trials and studying the dosage.
That's very good to know. Thank you for answering that question. And so another question that I kind of have about vaccines coming out for children is, when vaccines first came out for adults, they had the emergency use authorization, and some have now moved to the full FDA approval. Could you talk about the approval status of the upcoming vaccines for pediatric use in regards to whether they will have the emergency use authorization or the full FDA approval when they are first made available?
Yeah, I have to say I don't know how it's determined. the reason why it was emergency approval, because nobody knows how it's going to affect 360 million people when we give the vaccine. So if something happened, then we're going to stop. But over the course of a year now, almost a year now that we're giving the vaccine, we see the safety aspect of the vaccine being so safe. That's why the government moved forward to formally saying that this is like now a formal recommendation versus a emergency use recommendation. I would think in line the same way for kids. Once it's rolled out and if it's safe, then the CDC will say that, hey, this is now the standard, because COVID is not going to go away, you guys. It's going to stay. And unless we all get vaccinated and the virus has nowhere to bind as to the host, then there's still a house for it to live in. Just think of it like that. If you want to get rid of like polio, you gotta vaccinate the whole wide world. Polio was gone, but now it's coming back because there's some pocket in the world who decided not to vaccinate. And to not have this virus around, we gotta try to vaccinate at least 90% of our populations, so that it has no place to stay.
Yes, that's a very good point. And so kind of one of the questions that we have for you is, what types of conversations have you had with parents and teens about children getting vaccinated so far or getting vaccinated in the future?
Absolutely. Yeah, so that's a very common question that parents ask me. Should I vaccinate my kids? Should I vaccinate my kids if my kids have asthma? Should I vaccinate my kids if my kids had a history of diabetes, etc.? So my recommendation is to be honest with the parents and say, yes, there are data that I know, there's data that I don't know, just like you. However, I vaccinate my family, my kids, and it's as safe as I can reassure you that the messenger RNA is not going to go in and change your whole entire DNA profile and make you into a different person. It's just to affect the it goes into the cells and it promotes the making of more of the proteins, like similar to the virus, so that your body kind of build the antibodies against that protein. So yeah, I can give them the details if they want it, and I can reassure them that I see a lot of patients getting it, and my patients getting it, my family's getting it, and that kind of and then just out at the end of the day, you gotta let the individual parents decide, and we don't want to push people to get vaccinated, but we want to present the facts, and we want to present the science, and we want to talk about it, and we want to detail it so that people understand when you get the shot, what's going into your body and how your body is going to respond. And I think when people understand that, they can make the right decision.
And I think that's a really important point of kind of making sure that people have that understanding of what the vaccine does and doesn't do to your body, and how it can give you this level of protection that is necessary to prevent you from getting COVID-19 or prevent you from ending up in the hospital or with severe illness with COVID-19. And I think that's definitely something that we talked about last week during our FDA approval and lingering vaccines myths webinar. Was just about kind of the different things that people are still wondering about the COVID-19 vaccine, or what things are still stopping people from getting the COVID-19 vaccine. And a lot of times it is kind of not understanding the way that the mRNA vaccines work, or different things like that.
That's right.
And so one other question that I have for you is along that same line is, what concerns do parents have about their children getting vaccinated or about the COVID-19 vaccine in general?
I think the main concern is the unknown, Amanda. So some people share the story that, hey, I just want to wait a week or 2 weeks in and see if, let's say 100,000 kids have gotten the vaccine across the country, if there's any news, because I don't want to be the first one. and that's okay. Um, um, but people just need to know that before we even propose to give it to the people, there have been clinical studies across the countries, in thousands of patients who have gotten the vaccine before we roll it out to the entire country. So that's the most common question is that I don't know, doctor. I don't know what's gonna after the vaccine. It just I can't predict. I can't either. If you ask me to predict what's going to happen to your child, I can't either. But I can tell you that from only clinical experience that what I have seen, and I think that's the most the number one concern that holding people back. Yesterday, I was watching the NBC News live. So they did a survey of parents who have those kids 5 and older, and asked them whether they would consider a vaccine. So there's only like 25% say I'm going to get it right away, and then the bottom 25 say that I'm not going to get it, and then the middle 50% would say that I need more information. I want to wait a little bit. So as you can see, there's a large population that needs to be given the facts and the data so that they can analyze for themselves and read for themselves and research for themselves. I encourage people to Google, go to sites, as long as you don't go to a site that just have one view and didn't present any science to you and data to you, then you're okay.
Yes, making sure that we're getting good, reputable information is very important. And it's definitely been something that has made this pandemic very complicated, I would say. So the last question I have for you is, what advice would you give to parents, teens, or children that are hesitant about getting their child vaccinated?
Yeah, I would encourage them to, ask themselves, what is their most concern? And what is your belief? And then from there, I would encourage them to read the clinical trials data, watch the news, talk to friends, talk to coworker, and then gather your information first before you decide. And that's what I would do. That's what I tell parents all the time. I'm not here to push the vaccine. I don't have any gain from it. However, as a society, we should protect other people too, and to be considerate, because we live in a big society.
Thank you. Dr. Dao, thank you again for joining us today and sharing all of this valuable information with our audience. To our audience members, if you weren't able to tune in for the entire event or would like to share this webinar with other people, the recording will be made available soon on the Markkula Center YouTube channel. To let you know about our next upcoming webinar, we will be talking with Gary Spitko on next Thursday, October 28th. He is a professor at Santa Clara School of Law, and we will be talking about what employees and employers should know about vaccine mandates and more legal questions regarding COVID-19 vaccinations. In the meantime, I encourage you to visit the Get Vaccinated page on the Ethics Center website for more information about the work that we are doing as a part of this Get Vaccinated campaign to encourage people to get vaccinated. Thank you all for tuning in today, and we look forward to seeing you next time. Bye.
Thank you, everybody. I think it's great work, Amana, and your school and your department. So thank you so much for inviting me today.
Thank you for being here.